cold.
Footy track.
Have you been tested?
No, maybe I should, but you got it. No. Jill, can I start with you? Just
Yes.
the tighter restrictions on the border, some people, I guess, feel confused about why that's come in now. Does New South Wales Health and the MLHC have any more information about why that's come in and, you know, why it's necessary, I suppose?
Well, the border restrictions have been put in place for one really good reason, and that is because we have continued to see the growth of the coronavirus in Victoria. And the restrictions are in place really to keep the residents of New South Wales safe. It is as simple as that. However, actually policing the border and the permits is a complex undertaking, but it's all there to help keep us safe.
I just mean in terms of the I guess the tightening of the automatic application for a pass. People might say, well, there's no new local cases in places like Albury or Wodonga. Why are we being constricted? Do you have any inside word on whether they're nervous about seeding, as you mentioned earlier? Is there anything like that to your knowledge?
Well, I think one of the issues that we saw with the former order was that once people in those border towns were either side of the border, they could actually keep travelling. So that just put us at heightened risk. So now we've seen very, very clear communication in the permits that if you live in a border zone, you cannot, so if you're going from New South Wales across to Victoria, you can only travel in that border zone. And if you go across into the bigger part of Victoria, such as to Melbourne, then you're not actually permitted to do that. And if you do, you've got to come back and self-isolate. So I think actually tightening that up, and vice versa on the other side, I think is really important. And in Murrumbidgee, we've got the Hume Highway and a number of highways that go through to other capital cities running right through our district. So for me as Chief Executive, we have that heightened risk around people travelling through our region, stopping, buying coffee, spending the night, going to a caravan park. So that puts our area at risk. So I feel as Chief Executive of this region, comforted in the new order because it really clearly defines now who can and can't come into our state, which will help keep us safe. But I want to just also say that I understand for people living in that area close to the Murray River, the difficulties that places on their everyday life, and I want to acknowledge that because we are asking people to really be patient and work with us and change some of their daily practices, such as where they shop, where they work, more people working from home. So it doesn't come without pain for people living across the border region.
Is the MLHD prepared at all for people to suddenly, for more demand on its services? Because I imagine people will, and we spoke to a man yesterday who simply said that he just actually had changed doctor to get around the fact that it was all going to become quite difficult to see health services even with a permit. So is the MLHD expecting any sort of rise in that demand?
So there's two parts to your question. Some parts of our health service that are down outside of the border zone, where we're really working with those communities where people don't have to go to Victoria for time critical procedures or health related activities. If they choose to change and access the services in New South Wales, we are working with the medical staff in some of those towns to look to see how we can support them to access other specialist services in the Murrumbidgee region. The other thing is, in terms of being overly across our district prepared, I mean, clearly we have made all the preparations around the opportunities to expand our intensive care unit and train additional staff to be able to work with ventilated patients. So that work has continued. We've received additional ventilators, and we absolutely keep ourselves ready for that worst case scenario.
The Bateman's Bay outbreak, are you concerned about that at all? Obviously the far south coast is very popular with people from the Riverina, and we are still allowed to go on holidays and visit other regions. So is that one a concern at all?
Well, any case that we see that's ceded to a regional part of the state is a concern to all of us. But that's where we can all play a part in that. If we are all vigilant about the fact that whilst we have no cases here, we all need to understand COVID's not gone away and it can come to any of our communities at any time through travellers. So that's why we've got our COVID safety plans in our businesses. That's why we've got our restrictions around mass gatherings. That's why we wash our hands, and that's why we're keeping our social distance. So if communities abide by those things, they can help keep themselves safe, and everybody has to be vigilant. And I keep hearing people say we don't have COVID in our region. You don't know that, and we always have to be alert and aware that it could come at any time, and we need to be prepared.
How concerned are you that we'll see cases crop up again here in Wagga?
Well, I live this every day, and I just obviously keep myself prepared for the fact that a traveller could bring COVID into our region, and as a health service we are here to help protect people. So we just keep all of our plans absolutely up to date. We've employed extra people to do the testing so that we can know when it happens. The worst thing that can happen is if somebody doesn't come forward for testing and they either go to work or they go into the community, into places like shopping centres, restaurants, and that's what we've seen in the Crossroad Hotel case. And that's why we're asking you to get tested early, because the earlier we know, then we can do the contact tracing, we can put all those people into isolation, and we can ring fence any potential outbreak. So yes, we're concerned about Wagga, but we're not only are we keeping the hospitals ready for the worst case scenario, but we've also increased our staffing around testing, and we're doing screening as well. So we're doing all that work to help keep you safe.
Len, do we have any update on how those two cases, I believe it's 2 cases in the one family in Albury, what's their condition? Do you have an update on that?
The only information currently is that, as far as I'm aware, they're being managed in the community. And remember, about 80% of individuals who contract COVID will have relatively mild disease and will not require hospitalisation. So that's the information that I have currently.
And we're seeing a lot of big-hearted people sewing masks, creating masks for communities, especially the more isolated communities. Do you have any recommendations around materials? Can we use anything? How effective are they? It's good to see people helping.
Yeah, there is evidence that face coverings actually protect, and even in Victoria people are allowed to wear bandanas or other form of cloth coverings, and there is actually guidance on the World Health Organization website, and things like multiple layers will improve, and whether or not you put a little pocket in for a filter that you can use, but that information is available. I think it is important that masks are not a substitute for physical distancing. It's an additional tool to help for people who for some reason cannot socially distance. But if people have symptoms, they should really stay at home unless they're going to seek healthcare. And if they're going to seek healthcare, is to let the practice or the provider know that I have respiratory symptoms. Because the last thing you want is somebody sitting in a waiting room for half an hour amongst other vulnerable members of the community and transmitting the virus. I think it is also important, though, for people to seek medical care if required. The public health order is very, very clear that if you require emergency care, you do not need a permit. You just access care as you would normally do to the closest appropriate facility. And we appreciate that it's an imposition on the community, but as our CEO has said, this is to keep us safe. And the problem with COVID is that 2-week lag time, because the information that we have now is really transmission that occurred between a week and 2 weeks ago. And I think that's why having the tighter border restrictions is a good step. Because once the disease gets away from you, it really, really is very, very difficult to control, and you probably could end up with stricter lockdown measures which may be in place for longer, which is actually more of an imposition on people's normal way of life.
Just got one more maybe for you, Jill. So just with those border zones, say someone lives on one side and works on the other, are they expected to now be working from home unless it's absolutely necessary? And what sort of reasons might someone have to work on the other side?
So again, the order's really clear about people crossing the border if they're living in one of those border communities for work. And it does say there that people who can work from home will need to remain working from home. So it's people who work in the service industry and such as health who will be required to have a permit to travel across, for example, to work in a hospital. Yeah. Thank you. Thanks very much, everybody.
Thank you.